Hello, good afternoon and welcome everybody to our weekly RevitaLive session. Glad to have you with us again today, and it's always a great feeling to be able to interact with you all because of this current MCO situation. I know many of you all can't take the opportunity to go out and see your friends, colleagues, your doctors and so on. So as always, I get this opportunity to meet you all once a week, and again.
Weeks was a shock.
Yeah.
It was just shocking that Malaysia had to enforce MCO. We thought we loved our freedom and so on.
Yes.
But it's good that our citizens, we all understand what's going on. Unlike what you see in the media social in Western countries where people are protesting.
Yeah.
It's not even lockdown. They're just told to stay at home. There is no MCO there. It's just advisory, stay at home, yet they can't stay at home.
Yeah, true.
But here, at least, our Malaysians, majority, understand the problems we face, because as you know, this is a disease of the century. If you lose it, you are gone. Whether you are healthy or you are not, you have an equal chance of dying, basically.
Yeah.
In some countries, in the UK, for example, the death rate is more than 10%.
Yeah, it's really high.
It's very high. So we are quite fortunate. Our death rate is 1.7%. Of course, we do feel, the restrictions enforced on us. We are so used to going out every day.
Very true.
Going for nasi kandar, going for hawker food and so on.
Yeah.
And suddenly we are just confined in our tight space. Some of us have only maybe 600 square feet to sit in.
Yeah, very true. Yeah.
Or even less. But I think when you think about life, it's a time to reset your priorities. I think nature tells us that you've done enough, you have been searching for money for a long time. For many people out there, for us we are still searching, right? But for many of them who are already super rich, big businesses, they've all made a loss, because I think it's nature's way to say, hold on, what's priority in life? Help each other. Be alive for as long as possible, and come through it.
Oh, fantastic, Amir. I think that's a very good pep talk that I think our viewers will really appreciate. And speaking of that as well, I think during this Ramadan month, what I miss the most, of course, is the Ramadan Bazaar. And I think a lot of our viewers also probably will miss that. How about you?
Yeah, definitely. I mean, I'm also a frequent visitor every year to the Ramadan Bazaar. Everybody looks forward to it because of the variety of food you get.
Yeah.
But thankfully now, I'm quite happy because, my wife's at home. So they cook the food which is even better than the Bazaar Ramadan.
Yes, good.
So in a way, it's win-win situation for us.
Excellent, Amir. I think most important, viewers, is maintaining your social distance, frequently washing your hands, even when you're at home as well. Of course, when you are around your family at home, you don't need to wear your mask, but when you're coming out to hospital or when you're going around town and everything, please keep your mask on. We have adhered to the strict principles, and of course we have done our testing, and also it's quite okay. Anyway, Amir, it brings us to the important topic that we're going to discuss today, which is our focus. We are going to be talking about obesity and cancer. And you being a consultant, a radiotherapist and oncologist, deal with cancers for the last 10 years plus in this field itself. And currently, with our National Health and Morbidity Survey study in 2015 has shown that about 30% of the population is obese and about 33% is overweight. So, I mean, is there a direct link between obesity and cancers?
Right. So, at the moment, when it comes to cancer, etiology, and risk factors, the only direct link proven to cause cancer is smoking. Right? But There are many other factors that are associated. What it means by association is that we cannot directly prove, because you cannot do a study where you take 10 people who are thin,
Right.
and another 10 people who are equally thin,
Right.
and then you just feed one group with a lot of food, make them obese,
Yeah.
and then compare two groups, the
Yes.
thin versus the obese.
Right.
What is the difference in terms of cancer risk?
Right.
We can't do that kind of study.
Yes.
We used to do it for smoking in the
Okay.
1950s and 60s,
Right.
but you can't do that now. It's not ethical. So it is associated risk, just like food you eat. We know that sugar,
Right.
fatty foods, unsaturated foods,
Right.
preservatives, chemicals, these increase the risk of developing various types of cancers, colon cancers and skin cancers and so on. Even certain creams that you apply, which are banned in this country, but they are available in other countries,
Right.
which contain mercury and so on, can increase risk of skin cancers.
Right.
So obesity is associated with an increased chance of developing cancer.
Okay.
That is recognized
Right.
in the Western world. If you look at the Western world today, US for example, the risk of obesity is very high, and the cancer incidence is also much higher than what we face here.
Right. Right.
And it's all attributed to food intake.
Right.
As the saying goes, you are what you eat.
What we eat. Yes, perfect.
Right? So if you look at, in contrast to Japan, for example, you don't find obesity commonly there.
Right.
It's very rare. Anybody who's overweight also is rare.
Right.
And their risk of cancers are not that significant,
Right.
except for one cancer, stomach cancer.
Right.
But that is due to their diet,
Diet. Yes. Correct.
because of the raw meat and raw fish and so on.
Residue.
But if they did not take sushi and raw meat, their risk of cancer is very low because of their diet, and they are not overweight, obese. But if you contrast that to US and the European countries, majority are overweight and obese, and the risk of cancers are very high. Breast, colon, and so on.
Correct. Yeah, I think I would like to ask your opinion also. I mean, in terms of genetics, do you think genetics actually play a part? Because some of my patients who come in because they are obese tend to tell that, especially the younger ones, like in their 20s and so on, my parents are obese, so I'm actually following them. And they don't seem to understand that probably it's an environmental factor that is causing the obesity. But in terms of genetics, in terms of cancer, is there a causal role?
Right. So there are two things here. One is how much of risk there is if you have got family members that have cancer. Most cancers today, 90% is not genetically induced by inheritance.
Right.
That means it has nothing to do with your mom and dad having cancer. Most people who develop cancer today do not have a family member who have cancer.
Yes, I think it's what you call sporadic.
Sporadic.
Yeah.
Only 10% actually is genetic based.
I see.
And there are some genes that you can test.
Yes.
Like we know famous actresses like Angelina Jolie
Yes.
did a test, found out to have genetic problems,
Yeah.
and she did surgery to prevent cancer.
Correct.
But that is less than 10% of the population.
Yes.
So 90% is sporadic, meaning that it is nothing to do with your parents. It's nothing to do with the way you were born and so on. It is the way that you have been brought up probably, the diet that you've been exposed to, the smoking that you've been doing, the alcohol consumption that you've been taking,
Correct.
the lack of exercise.
Yes.
So all these factors increase your risk of cancer. So people may say, oh, I may have genetic inclination to developing cancer, but it's only 10% of cancers that have that.
Yes.
Number two, some people say, is obesity genetic? That means some people, they eat so little, they put on weight very fast. Some people, they eat like horses, they eat 2 tons a day, but they are so thin. So the scientists have come up with this theory. They have found certain genes that link to obesity and overweight. But you cannot blame that 100%. Because again, like cancer, maybe only 10%
Yeah.
of overweight people have that gene.
Correct.
90% is your own fault.
Yeah, true. Actually, it's how we behave. Like what you said earlier as well, is what we eat is what we become.
Yes.
Right. Another thing, I mean, if you're looking at our population also, because we are now approaching a developed country status. 2020 was when we were supposed to be a very developed country. Could it be also that because our population is aging,
Right.
So we know very well as the population ages, then you're going to have more old age diseases, and cancer is one of them as well.
Very true.
Yeah.
One of the risk factors for developing cancer is increasing age. Those who go on to their elderly lives above the age of 70 have higher risk of developing cancer.
Right.
That happens because your body has been living for so long, you have been exposed to all kinds of toxins and chemicals in your life that your cells cannot repair anymore.
Right.
And your immune system weakens. Just like how you can imagine if you are a 90-year-old person. Most 90-year-old persons are usually weak, except Mahathir. Right? Most of people are usually weaker. Some are even dependent on nursing homes and so on.
Yes.
So their immune system is weak. So when they develop a cancer, which is due to a mutation, they cannot fight it. They cannot repair. So the cancer just spreads.
Yeah.
So definitely, age is a risk factor. As you grow older, your risk is higher.
Well said. I mean, I think that's a very, very simple and easy to understand analogy on cancers and how they start. For me, I mean, as a breast surgeon also, I think my focus a lot of interest on breast cancers.
Right.
So as you mentioned about aging as well, so I think a lot of our viewers who are women who are postmenopausal, we know definitely there's a causative factor for breast cancer with obesity, right? So can you elaborate?
So what happens in postmenopausal women, a lot of these cancers are hormone derived, meaning that the cancers depend on the female hormones to be stimulated and to be kept alive and spread.
Correct.
Right? So that's why usually for breast cancers, especially postmenopausal women, we normally give anti-hormonal tablets to suppress the hormone levels. Now the interesting fact is, postmenopausal women do not have functional ovaries anymore.
Exactly, yes.
So where does the hormones come from? They actually come from fat. Your fat converts into hormones.
Yes.
And these hormones eventually trigger cancer.
Yes.
So we know that in postmenopausal women, we give anti-hormone medication not to the ovary, but to the fat itself.
Excellent, I mean,
So it's a different target. So you must understand that fat itself can increase your risk of having a spike in your hormone levels in your body.
Correct.
And if you are already in the high risk group,
Right.
your chance of developing cancer is even higher.
Yes, exactly. In fact, I think we will be taking more questions, or we will probably have a forum on breast cancer itself on a future date. So to concentrate on our topic with cancers, we have quite a number to go through.
Yeah. So just one comment.
Yeah, sure. I mean,
Now talking about obesity,
Yeah.
how does a person become obese? That is a very important question, right? It's not overnight and it's a long process. Usually you will be in your ideal weight, and then over time you go into the overweight category, and then you eventually develop obese if you do not control yourself. It's all about self-control. And the most important thing is the sugar intake. We don't realize, sometimes when we eat food or we drink something, we only calculate calories, but we don't look at the sugar content.
Very true.
It is sugar that makes a person obese.
Yes.
Some people may think it's the fat, oily food and all that. No, sugar is even a higher risk. So your Nescafe ice, teh ice and all that, even though when you say kurang manis, it is terlebih manis.
Actually, it's very true. I mean, we talk about diabetes as our number one killer and so on, smoking and so on. But that means if if our population are too addicted to sugar, taking that in large proportions, possibility of cancers occurring at an earlier age will be very true for you. I think you might be having a big problem later.
For people who develop obesity in the younger age,
Right.
that means their risk of cancer will be in a younger age. If normally a person develops cancer in their 70s, if you are obese from the age of 20, you might develop cancer in your 40s. It's just like smoking. You start smoking at the age of 20, but you develop lung cancer when you're 50.
Right.
Because it takes a long process before your body cannot cope anymore with all the toxins you have exposed yourself to.
Okay, I mean, we take a break and go to some questions from our viewers, if you don't mind.
Yeah, sure.
Okay, so we will start with our usual viewers that we have. Espel, yes, nice having you. She says hi.
Hi.
We have Rina also as well. Okay, we have Mr. William Tunggadi from Indonesia. Bagaimana menjaga kesihatan supaya sehat dan panjang umur, terbebas daripada kanker dan penyakit apapun?
Okay.
Thank you for the question, William.
Alright, William. So shall I speak in English?
Yeah, I think William understands
English.
yeah.
William will speak English, right? So the question is, how do we look after ourselves to prevent not only cancer but all illnesses? So we know in today's world, apart from cancer, the other illnesses that can kill you include diabetes, high blood pressure, and cholesterol, which will eventually lead to heart attacks. So in most countries today, heart attack is still the #1 killer. Heart attack is a simple term that I use, alright? But nobody gets heart attack without any reason. There's a stress on your heart over years that you have placed by your diet and lack of exercise and so on. Just like cancer. So, to look after yourself overall, watch what you eat, right? So you need a balanced diet. Do not overeat. So when you feel that you have already eaten enough and your stomach is full, that's enough. Don't finish off your plate. I know when you go to some restaurants and so on, especially if you go to US, you just order burger and chips. Their burger and chips is for 3 people to eat.
Humongous.
Humongous, right? Because I have experience in that as well. Whereas you go to our local McDonald's, probably they give you 1 burger and chips is not even enough for you.
Yeah, actually, yeah.
But if you go to US, it's totally different. Example. So watch what you eat. Have a balanced diet. Reduce sugar as much as you can. Cut down chemicals. What do we mean by chemicals? You see, people say that meat is not good. Some people believe meat will cause cancer.
Yeah.
A lot of my patients, when they get cancer, they stop eating meat. Before they get cancer, they eat. But once they get cancer, they stop. They want to eat also cannot because their family stop them from eating.
A lot of them convert to become
patients
vegetarian.
don't die from cancer, but they die because no meat. But the point is, it's the sausages, your nuggets, your burgers, your fish fingers, your chicken fingers, all these are processed food. Your tuna in cans, your sardine in cans, all these frozen vegetables which have chemicals, they are not good for you. We live in a world where we are stuck. You cannot buy organic. You cannot grow your own organic. Even you go to buy the organic, you cannot guarantee it's really organic. Because a lot of this organic come from countries where you cannot verify. You know, some products come from Thailand, for example. Many products are good, genuine, but some products are not. You never know. In Thailand, boy and girl also, you cannot differentiate. Just a joke, alright? But what I mean is, one is diet. Number 2 is exercise. You need input and output. So whatever you keep, if you don't burn, you don't exercise your heart, it doesn't pump, you don't get blood circulation. You need good blood circulation to stimulate your immune system. Your immune system is like your army, it's a defense. If it's always lazy, when there's an attack, it will not be prepared. But if you exercise and you stimulate your immune system, it will always be prepared. Even if you get the normal cold and flu, you will be able to cure faster.
Excellent. Okay. We continue with dari Eva Visiana. Selamat siang, Dr. Amir.
Siang, Eva.
Selamat siang, Eva. And thank you for joining us. We have Ikun Tan. Welcome. And Linda Davis, she always joins us every week. Hi, Linda. Welcome. Good to see you. I hope we shared the recipe for cauliflower rice, I think, if I'm not mistaken, yesterday. So please have a look at that. And Main Mindy, good sharing, Dr. Amir. Yes. Yuan Zin, can't listen clearly. Okay, we look into that and see. Espel, soft voice, not able to listen clearly. Maybe we can get our this one to see. Is it because the audio?
Yeah.
Okay, yeah. Louder.
Louder.
Okay.
Maybe we'll hold the mic nearer to the mouth.
Yeah.
Okay.
Makanan apa yang tidak boleh dimakan untuk terhindar dari kanker, atau pola makan dan pola hidup yang bagaimana supaya terhindar dari kanker dan obesity?
Okay, William. So the question is, what food can we avoid to avoid illnesses like cancer, and what food is good for your general health? Just like what I mentioned earlier, cutting down on your chemicals, cutting down on your sugar. All right. So if you are used to having a lot of sugar in your food, for example, condensed milk, or in Indonesia, susu kental, if you're going to have 3 spoons of sugar, white sugar in your coffee, that's bad. If you always have chocolates and cakes every day, morning, lunch, dinner, that's bad. Right? So you have to calculate all this. But good sugar is available in fruits. So if you have your bananas, your watermelons, your papaya, and so on, this is good sugar. Right? Vegetables are good because these are antioxidants. Antioxidants are very important in repair process. So you need antioxidants to repair your cells which are damaged by the sunlight or by the food you eat or by age. As you grow older, your cells are damaged. So all these fruits and vegetables, some people will say, I want to take multivitamins. Yes, but you must understand, multivitamins, they also contain chemicals. So you are eating multivitamins, antioxidants which are not fresh, and you're exposing yourself to chemicals and you don't know the dose. If you just take simple vegetables and fruits, you'll be quite safe. Some people, they are smokers, 20 cigarettes per day, but they take 10 supplements. No point. It doesn't work.
So it's good, Amir. So I see that you actually advise a lot of nutrition therapy also to your patients who undergo chemotherapy, radiotherapy, right? I'm sure that's very important as well.
Yes, I do. I think it's very important for patients who are undergoing treatment. The body is undergoing a lot of stress, so they need to eat healthy, good diets, which is high in vegetables and fruits, antioxidants, a good source of protein. You need your fish, your eggs. For those who are vegetarian, there are vegetarian sources of protein. All right? We need protein. You cannot live without protein. Reduce carbohydrates. This will make you feel healthier.
Okay. We continue with Nilawati Siregar. Semoga sehat selalu. Terima kasih. William, yes, bapa saya 62 tahun. He's telling us that. And then we have a question from Min Farhanim. Hi, Farah. Always glad to have you. Hi, doctors. I have a question. What type of cancers are most likely associated with obesity?
Right.
Yeah.
So there are 2 types of cancers. For women, it's breast cancer, and for men, it's colon cancer. Why colon? Because all that sugar, that fatty foods, unhealthy food that you eat and become obese has to go through your colon for processing. So eventually the colon has to go through under a lot of stress. Because you imagine, if somebody eats only 500 grams per day of food, very healthy, right? But if somebody takes 2 kilos of food a day, your colon, your stomach has to process that 2 kilos. And that 2 kilos could have all kind of chemicals in it. All kind of nitrous amines, benzynes, and so on, which eventually your cells will give up. They cannot process anymore, and then cancer develops.
Actually, it's very, very some fact that actually people will learn about this from here. And okay, hi Paylin, glad to have you as well. She likes to ask, so vegetarians will not help to reduce risk of cancer?
Okay, for your information, many of cancer patients are vegetarians. So there are people who believe that being vegetarian means your risk of cancer is almost zero. Sad to say, it's not true.
I see.
So, you know, although the risk is not as high as Western countries which eat a lot of meat, right? But if you are a pure vegetarian, you still have a risk of developing cancer. Again, the question comes, right? When you say you're pure vegetarian, a lot of these people take a lot of tauhu, soya bean. Now, tauhu and soya bean itself contains female hormones to some extent. There is estrogen in it. So if you are taking a lot of tauhu and soya bean, you are exposing yourself to a lot of hormones. These hormones eventually trigger cancer.
Yes, correct.
So everything good must be taken in moderation.
Yeah.
You don't go excess, right? So being vegetarian doesn't mean that you will not have cancer. But your risk is probably less than a person who eats meat every day.
Yeah. Okay, great. I mean, we have a question from Espel. Is weight gain a symptom of cancer?
All right.
Yeah.
Actually, it's the opposite, Aspal. Normally, cancer patients have weight loss. It's very rare that cancer patients have weight gain, unless cancer patients come in the early stage where the cancer is still very small, it was not yet detected, and the patient has not developed symptoms from the cancer, and they eat like normal, what they eat. So it's possible that early stage cancer patients may not experience loss of weight, but maybe weight gain if they have a lot of calories. But over time, as the cancer develops, usually cancer patients lose appetite and they start losing weight, because cancer produces a lot of chemicals in the body to dissolve your energy, because they also need energy, and cancer needs sugar. So even if you stop eating sugar when you get cancer, the sugar is still processed from your normal cells.
Right.
So it doesn't mean now you stop sugar means the cancer will die. No, but it will help. It will help to weaken the cancer.
Right. Actually, it's true. So I mean, because there's some patients, even patients of mine who, after surgery, planning to go for chemotherapy and so on, choose to cut down their caloric intake, telling that because they take less calories, so they will feed less to the tumor. Right. Is that a myth, or is that something substantiated?
So it's a myth, because your body requires the calorie. Otherwise, if you don't have enough calories to sustain your body weight, your own body will use up your fat reserves and your muscle reserves. That will make you weaker. Yeah. It's like going into fasting. If you fast, normally the body goes into a weaker process. But if you have cancer and you need treatment and you become weaker, your immune system becomes weaker, you will find it more difficult to fight the cancer. So you still need your normal calories, just don't overeat.
Okay, great advice, Ami. Okay, as a follow-up to Espel's question, she's asking which cancers can actually make you gain weight? Is there any cancers that can make you put on weight? As far I don't think so, there are any.
No, as far as we know, there are no cancers that actually make you put on weight. Now, there are conditions that may eventually develop into cancers. For example, women with polycystic ovarian syndrome, who have a lot of ovarian cysts, so their hormones are quite high, so they tend to put on weight. And some of these women do develop into cancer. So those women may be, right, who put on weight, but it's not because of the cancer, it's because of their hormones itself.
Okay, great. Lim Casey, Amir, Abdul Rahim, thank you. Nice to have you all. Amir, we have a patient of this one here, Shihola W.
Pak Elkaria.
She's a patient and she says terima kasih and very honored to be your patient as well. We have Muhammad Sharmizi. Steady, Dr. Amir.
Okay, Mizi.
Tan is asking, how fast do you lose weight with cancer?
Right. So in the early stage, weight loss is very minimal. It may only be 1 kilo a month or so on, right? But as the cancer progresses to second stage, third stage, and fourth stage, by the time it comes to the fourth stage, patients can even lose 5 kilos per week. So it all varies. Now you must understand that when a patient develops cancer, 1 centimeter of cancer is 1 million cancer cells.
Yes.
Now, it took 2 years for the cancer to reach 1 million, because cancer starts at 1 cell. That 1 cell undergoes mutation. It becomes X-Men. They cannot die.
Right.
They replicate, they become super strong. It's just like an X-Men. They are humans, but they are superpowered.
Right.
So cancer cells are like that. So from 1 cell, it becomes 2. 2 cells become 4, become 8, become 16. They keep dividing until 1 million. Average process, 2 years.
Wow.
From 1 million, it becomes 2 million.
Right.
2 million, 4 million. So imagine from 1 cm becomes 2 centimeter,
Right.
becomes 4 centimeter, 8 cm. By the time it reaches 8 centimeter, is stage 4.
Right.
1 centimeter is stage 2. The process can be very fast, from stage 1 to stage 4 in 6 months. So some people believe, oh, my lump is only 1 centimeter, I can still wait. For your information, 1 centimeter is already 1 million. You wait 2 months, it will probably become 2 million.
Right.
And 2 million, it can spread in your bloodstream.
My God, that's...
So we need to be careful when we look at sizes. So from stage 1, maybe you only lose 1 kilo. To stage 4, you lose 5 kilos per week. And then if you don't do anything, you lose your life very fast.
Yeah. Very scary actually.
Especially pancreatic cancer. Pancreas cancer is the most aggressive cancer in the body. because the pancreas functions to digest your food. And if it has cancer, it can't digest your food. Whatever you eat just goes up. So you tend to lose even more weight, and we lose patients very fast.
Correct. And the symptoms for pancreatic cancer also occurs very late, because of the position as retroperitoneum behind.
Yes.
Okay, we got an interesting question from Paylin again. My dad and my mom have colon and stomach cancer. Okay, does it mean I have high genetic predisposition?
Right.
Yeah.
So if you have two family members with cancer, like yours is direct, first degree relative. First degree relative means your mom, your dad, or your brothers, sisters. Now you have two family members who have cancer. So your risk is higher than 30%. It's not guaranteed. That means there's no guarantee you will get cancer. But your risk is higher than the normal person, more than 30%. So my advice is you need screening. So it depends on the age your mom and dad got the cancer. So if they were like 55 when they got cancer, you need to start screening at least by the age of 40. At least 10 years before they develop.
Right.
That is the standard usually, right? So there are methods of screening which probably Dr. Kiru will explain as well.
Yeah, sure. Actually, screening is a technique that we try to detect cancers happening in patients who do not have symptoms. They do not have any problem, and we want to determine and see whether they have cancer. And most classically, I think in breast cancers is one of the cancer cases that we can actually rapidly include screening into our population-based program. So that's why for breast cancers, we do a lot of screening programs in the terms of screening mammograms. I think we also do that for prostate cancers by doing a digital rectal examination. Is there any other benefit in doing screening, Amir?
Okay, the purpose of screening is not to prevent cancer.
Right.
It is to detect cancer early. Like I explained earlier, cancer takes about 2 years to be detected. You may only be able to detect it when it's 1 centimeter.
Right.
So it took 2 years. So if you do your breast mammogram today, maybe it may not be seen, but you need to repeat it at least 3 years' time.
Right.
So that by 3 years, if there was cancer, it would have been picked up.
Yeah.
Otherwise, you just missed the boat and carry on. So screening is to pick up cancer in its early stages.
Yes.
And also pre-cancer. Some cancers you pick up when they are pre-cancerous. That means they are not fully cancer, but they are going towards cancer. You pick them up, you don't need chemo, you don't need radiotherapy, you don't need all the toxic treatment, just a minor surgery and you are done.
Correct. I think that's why in certain cases, like for breast screening and so on, according to our guidelines, above 40 years old, you should already start, or you can approach your doctor to actually go for the screening program, and above 50 is already incorporated into our screening program in Malaysia as well. Okay, so I hope that answers your question, Paylin. I think she's got a follow-up there as well. So at what age should I start doing colonoscopy and endoscopy? Well, if I think from point of view is that if your parents were diagnosed, let's say example, at 50 years old, then you should start your screening probably 10 years earlier. There's no point for you to start screening in your 20s because that will be too early actually. Okay? Yeah. I think, shall we go on to the next question? We have William here. Saya mau tanya untuk pengobatan kanker yang mana lebih bagus kualitas dia di tempat ini atau tempat so minta maaf William, kita tidak boleh komen pasal benda di tempat lain semua. So hopefully you understand.
Ya, so kerana ini ya kita semua kerjasama, semua rumah sakit pun kawan-kawan kita. Ya, cuma kerana ini Facebook Gleneagles, so saya boleh bilang Gleneagles the best.
Thank you. So we got a question here from Mr. Chow. Yes, we are trying to deal with the sound quality. I understand it's quite a bit very faint. Please bear with us. Mr. Lim, is it true that two of your staff? Yes, I think management has already made a press statement on that issue. I think it's available online as well. So and of course, there's nothing to worry. We are adhering to all strict protocols, and as far as possible, we are still going on with our daily routine. Yes, thank you. Okay, Amir, I think we are coming quite. This program has been proceeding so rapidly. So many questions, very interactive crowd. we're coming towards the end of it. Maybe we answer another one more. Caroline, Henki, yes, hello.
Ya Caroline, lama nggak ketemu.
So, okay, Amir. In terms of obesity and cancer, do you think there is a benefit in terms of survivorship? Because as a surgeon, normally when we, when I proceed with surgery and everything, then after that we refer to our oncologist, and always the follow-up and everything, Amir probably will know. Are we looking at better survival benefit nowadays in terms of diagnosis of cancer? That means we are diagnosing earlier, or do you think our still survival rates in Malaysia is still quite bad?
Okay, there is a lot of awareness now in the public about screening. We see many people coming who are detected cancer who don't have symptoms yet, which is good, right? But majority of the population, you see, the reality is we are in a private sector.
Yeah.
In Malaysia, 20% of cancer patients are in the private sector, 80% of cancer patients are in the government sector. Alright? So the private hospitals only see 20%. Throughout Malaysia, only 20% of cancer patients.
Right.
And usually these cancer patients are those who can afford or who have medical insurance.
Right.
Right? And these are the people who are aware about screening, early detection, so their chances of survival is better than those who don't do any screening.
Yes.
Who present much later. So yes, the prognosis, the survival is better if you detect earlier. Just a rough figure, stage 1, average 90% cure rates.
Fantastic.
9 out of 10 people are cured, right? But if you come to stage 3, 50% cure rates. That means 5 people out of 10 are cured. That means we lose 5 people in the span of 5 years, which is what we're trying to avoid. We want majority of patients to be either stage 0, which is pre-cancer, or stage 1. And 90% cure rate is a very high rate. Please don't fall into scams of multi-level marketing products and outside supplements that claim to cure cancer. You know, like today in the COVID era, many people claim this medicine can cure COVID, that disinfectants can cure COVID, taking Dettol will cure COVID. Don't fall into this kind of fake scams, right? Your health is your asset. It's much more valuable than the money you have in your banks, all right? So important thing is to take proven treatment. So proven is come for surgery, come for treatment that's required. If you're stage 1, you may not even require chemo and radiotherapy. Surgery alone for colon, stage 1, surgery, and that's it. No further treatment.
Yeah, very true.
So early stage, definitely your cure rate is higher. But there are people who are still neglecting themselves. They know they have cancer, but they want to try herbal treatments, traditional treatment. Normally, I will say, if you want to try anything, it has to be additional to your proven treatment. You still need surgery. Then you want to try your herbal, it's up to you. Although it's not proven, I cannot say anything about it, but that's up to you. But you still need your proven treatment.
Yeah.
That's the most important thing, why we tend to lose our Malaysian patients.
I totally agree. I mean, I think our population is very inclined towards alternative therapy, especially when they get diagnosed with cancer or any form of dreaded disease. They tend to go to spirituality, or they tend to go into alternative medicine, which I feel, or we feel, that you should always go to mainstream health therapy first. And
I think what they have to do is they have to rephrase the term alternative.
Right.
Because it is not an alternative treatment to cancer treatment.
Right.
Whatever spiritual, herbal and traditional treatments you take, it's not an alternative.
Yes.
It is an additional treatment.
Yeah.
So the word should be adjunct or
Adjunct,
additional,
yeah.
not alternative.
Excellent, I mean, I totally agree. Yes. Okay, I think we are coming to the end of our day today. We have one question from Aspel here. Sorry. Yeah, if we treat obesity disease early, can we reduce the risk for developing cancer?
If we
Treat obesity disease early, can we reduce the risk of cancer?
Yes, definitely, because obesity is associated with the risk of cancer. The longer you are obese, the higher the risk of developing cancer. The shorter, like for example, if you are obese only for 1 year, so your risk is small. If you are obese for 30 years, maybe your risk is 30 times higher.
Yeah.
So it's logic and common sense. So try to, just like smoking, if you smoke and you decide to stop, good for you.
Yeah.
But bad for government because you reduce the tax. Anyway, good for you, right? But if you smoke for 30 years, then your risk of developing cancer is 30 times higher than a person who smokes for 1 year.
Yeah. Okay. I think we had a lot of fun today. Thank you, Amir, for addressing this very important topic.
Just one message I want to say.
Sure.
Be healthy, stay safe, life is important. But if you don't care about life, go on, smoke, go on, be obese, and go on, be my patient one day. Because I really need patience nowadays.
Okay, Amir. To everyone viewing, I know this is a very challenging time, something that we all are not used to. Now we are in the COVID era. MCO probably is a part of our life rather than something that is going to go away. It might still be around for quite some time. So, Amir, in respect to our patients also who are diagnosed with cancer, this is a very difficult period for them, especially to come for treatment and to undergo their therapies. They need a lot of support. They need a lot of positivity. So I hope our viewers will be kind enough to, in our Facebook link, as well as our link in Penang Weight Loss Clinic hashtag, please write down some positive messages, share your story on our Facebook platform. I think that will go a long way to kind of like reduce the impact of the current situation to our patients who are suffering. Any last words, Amir?
Life is the most precious gift that you have today to cherish. Enjoy with your loved ones. We will soon be out of this problem. We will soon go back to our normal lives. It may take time, but we will get there. We Malaysians are strong. Just keep up the fighting spirit. God bless.
Excellent. With that, have a great week, everybody, and hope to see you all soon.